Adapting to new technological innovations is a constant in this field of medicine. Dr. Sharmila Dorbala from Brigham and Women's Hospital in Boston joins me now to talk about the latest developments in nuclear cardiology. So could you please provide a brief overview of your talk?
Happy to be here, and it's really an honor for me to highlight the cardiovascular science from 9 different countries presented at the SNMMI 2021 meeting. Primarily, there were a number of talks on perfusion imaging of the heart and skeletal muscle, imaging using novel molecular radio tracers, cardiac amyloidosis imaging, as well as a few topics on machine learning applications for microcalcification imaging, as well as perfusion imaging.
Let's discuss some exciting recent developments in nuclear cardiology research.
So there are actually many exciting developments that were presented at this meeting. And in the interest of time, I'll only be able to highlight a very few of these studies for your viewers. One of the key studies was from Yale University, from Drs. Liu and colleagues. They showed the feasibility of quantifying lower extremity blood flow using dynamic rubidium-82 PET imaging in a porcine model of acute ischemic limb. And then they validated in healthy humans as well as in humans with diabetes. I thought this research was very interesting because it opens up an entire new area of investigation into peripheral arterial disease, which is one of the major public health problems. 2 other key novel studies came from Hanover University in Germany, and they showed the utility of gallium-68 FAPI. Dykman, Bengal, and colleagues studied 12 patients with reperfused myocardial infarction and showed that FAPI uptake was seen in regions without FDG uptake corresponding to regions of late gadolinium enhancement on cardiac MRI. Notably, what they found was that half of the segments without significant LGE also exhibited or showed FAPI expression, suggesting that there's fibroblast activation even in the remote non-infarcted myocardium. From the same group, Hess and Thackeray colleagues showed using in vitro and animal studies upregulation of FAPI signal in regions without FDG uptake 7 days post-MI, and they also showed that this signal intensity decreased by 21 days. Together, these 2 studies provide key insights into the pathophysiology of post-myocardial infarction LV remodeling. 2 other studies I wanted to highlight came from Dr. Singh and Slomka and colleagues from Cedars-Sinai Medical Center, and they reported on the prognostic value using machine learning methods, both SPECT and PET myocardial perfusion imaging.
To look into the future, what do you see for the future of nuclear cardiology?
That's really a great question, and I think the biggest challenge is predicting the future. But from the research presented here and looking at the field right now, I see a future that's exciting and bright and full of possibilities for nuclear cardiology. Really building on the strengths of molecular imaging as well as quantitation, nuclear cardiology, I believe, is poised to uncover novel disease mechanisms, image the entire cardiovascular system, and use machine learning. Each of these advances opens up the doors for precision medicine as well as theranostics.